Hi everyone, I know many of you watching this video may have experienced leg pain while walking, cramps at night, or even wounds on the feet that seem to take forever to heal. Often people just brush these off as normal with age, but the truth is they may not be normal at all. Let me ask you, do you often feel pain in your legs while walking, as if your muscles are crying out for oxygen? Do your feet sometimes feel unusually cold compared to the rest of your body? Have you noticed slow-healing wounds or sores on your legs and feet, or do you experience cramps at night that wake you up from sleep? If you said yes to any of these, then please listen carefully, because these could be signs of a serious condition called peripheral arterial disease. Peripheral arterial disease occurs when the arteries in your legs become narrowed or blocked due to plaque buildup, a condition known as atherosclerosis. This reduces blood flow to your legs and feet. And when your muscles and tissues don't get enough oxygen, every step becomes painful, and even the smallest wound can become a long-term problem. Peripheral arterial disease affects over 200 million people worldwide. In India alone, it's estimated that 10 to 15% of people over the age of 50 suffer from peripheral arterial disease, but most remain undiagnosed. In fact, up to 70% of peripheral arterial disease patients are either asymptomatic or experience vague, non-specific symptoms. That's what makes early detection so critical. Some of the dangerous signs of peripheral arterial disease include cramping pain in the legs or hips during walking, a symptom called claudication. You may also feel numbness, weakness, or heaviness in your legs. One foot may feel noticeably colder than the other, and you may notice sores or ulcers that just don't heal. Shiny skin, hair loss on the legs, and weak or absent pulses in the feet are also signs that your circulation may be compromised. These are not just discomforts. They are warning signals from your body that blood is not reaching your limbs as it should. Peripheral arterial disease is much more than just a circulation issue. It's a red flag for your entire vascular system. If left untreated, it can lead to severe and life-threatening complications. One of the most serious is critical limb ischemia, a condition where blood flow is so restricted that it causes constant pain, non-healing wounds, and tissue death. Infections and gangrene can set in quickly. In fact, peripheral arterial disease is responsible for more than 60% of non-traumatic leg amputations. But the danger doesn't stop there. People with PAD have a 6 times higher risk of heart attack or stroke. That's because the same plaque that clogs arteries in the legs often affects arteries in the heart and brain as well. So, if you have PAD, chances are it's not just your legs that are at risk. Your entire cardiovascular system may be compromised. But here's the most important thing you need to know. Peripheral arterial disease is not the end of the road. It can be reversed. At SIMS Medical Center, Hyderabad, we offer a unique and powerful approach to reversing peripheral arterial disease through integrative treatment. This approach combines the best of allopathy, homeopathy, and targeted diet therapy, treating the disease from all angles, not just masking the symptoms. Allopathy helps to immediately control symptoms, improve circulation, and stabilize the condition. Homeopathy works in parallel to stimulate your body's natural healing processes and promote vascular repair. And our specialized diet therapy, using evidence-based approaches like the ketogenic diet and carnivore diet, helps remove the root cause by addressing insulin resistance, reducing inflammation, and naturally cleaning up arterial plaque. These nutritional strategies work at a cellular level to restore metabolic balance and support long-term vascular health. By combining these 3 systems of medicine, our integrative treatment plan reduces pain, improves walking distance, accelerates wound healing, and most importantly, helps patients regain their independence and freedom of movement. This is not just treatment, it's transformation. So if you or someone you care about is living with leg pain, cold feet, slow healing wounds, or nighttime cramps, don't ignore these signs. Peripheral arterial disease can silently steal your mobility and severely impact your quality of life. But with the right treatment, you can take control and reclaim your health. At SIMS Medical Center, Hyderabad, we believe that no patient should live in fear of losing their legs. Healing is possible, And it starts with taking that first step. Remember, every step you take towards treatment is a step closer to freedom. Don't let peripheral arterial disease stop you from walking the journey of life with confidence. Call us today or visit us for your consultation, because every step matters.